Hi, my name is Dr. Raja Adnan Ahmed, and I am a psychiatrist and I work in UK. And with me this morning is Dr. Rahman, Dr. Rahman, who is a young uh, graduate of 2021 from India, and who came to UK in 2023. And the reason we are doing this interview is about the IMT, the internal medicine training. He has secured an internal medicine training post in the UK, and this was about understanding his experience and his advice to how to improve your chances. Because I know a lot of a lot of IMGs wants to do IMT, but over the years it has been becoming more competitive. So first of all, Dr. Rahman, thank you very much for giving me the time and on the weekend and joining this.
Thank you. Thank you, Dr. Raja. It's always been a pleasure to connect with you.
So can you just tell us a bit about your background? I mean, I already told in the introduction, but I think if with your own understanding of how things happen with you, I think it would be useful for IMGs.
So basically, I am a graduate from India, Delhi. I graduated in 2021, completed my internship, and then decided that I want to move to the UK. I gave my PLAB 1, I gave my PLAB 2, and then moved to the UK for observerships. I mean, during the same time, I did my observerships, which are also called as clinical attachments, just to gain some first-hand insight about how things work in the UK because it's completely different from how things work back home. It's a completely new system. And then slowly and steadily, once I gained a bit of insight through my attachments, I then decided that I want to be in the UK, and then I applied for jobs. I got my first job in the emergency department in near Manchester, and then I worked there for approximately a year. And then after that, I wanted to do medicine. So I wanted to move to a medicine specialty. I moved to a different hospital in London, and I've been working there for the last year. So that's my experience. I've also worked back home in India for a couple of months in different hospitals to gain
Mm,
insight gain experience into how
mm,
things work there.
mm. So
So
these jobs you said, the non-training jobs in UK, are they in medicine or are they in different other specialties?
So the first job that I did was in emergency medicine, and I would really recommend anybody who starts. It's a amazing opportunity to start in emergency medicine. You get everything under the sun in emergency medicine, and you get to learn medicine, you get to learn surgery, you get to learn obs and gynae, you get to learn pediatrics, you get to learn psychiatry, and I think it was a very good decision for
Mm.
me to start with emergency medicine as a job.
And you know, coming to the IMT, I mean, there are some basic requirements when people are applying for IMT job. Obviously, we are recording this in 2025, April 2025, and you were talking about the recruitment that has just happened for the August of 2025. So the things might change for the future. If somebody's watching it in the future, they need to have a look at the current criteria. But for now, IMGs need something called a CREST form, which is equivalence to show the equivalence of foundation competencies for them to become eligible. So, did you get your CREST form signed from UK or from India?
So I got my crest form signed from the UK, and I got it signed uh, in my first job after working a couple of months.
Yeah.
And I asked the consultant if they are happy to I approached them and they were happy to get me signed off because seeing me work, they wanted to see if I've done the crest form, the what is needed in the crest form. They checked me, and then ultimately they were happy to sign me off. So I think that was a good thing that I got it signed from the UK. So yeah, I think I got it signed from the UK, which was a good thing.
Yeah, I think just to let IMGs know that CREST form is basically a list of competencies. And if your consultant is happy, either they have observed themselves or they get evidence from other people to say that you're a competent doctor at the level of foundation, that can be signed from within UK. And as you said, it is sometimes about a lot of people don't approach their consultants just with the fear that they might say no. But I think it's just about approaching people and showing them the form. Doesn't have to be your consultant directly who you're working under, but any consultant who has you worked under in a department. So like in emergency
Absolutely.
medicine, you'll be working under so many different consultants. So in terms of IMT itself, I mean, you fill the CREST form, and then what was the next step, filling the.
So yeah, so basically when I decided that because I've always wanted to do internal medicine training, so that was not the question, but the question was how do I approach this entire process? After I worked in the ED, my entire focus was to build a portfolio in the sense to cater my portfolio capable for an IMT interview, because you need to have a portfolio which ticks all the boxes which are required for getting an interview for IMT. So it is very, very clearly mentioned on the IMT recruitment website
Yeah.
that there is a scoring system that is there. And if you just follow the scoring system and get exact scores that is required for IMT interview, you will get that. So it has everything, be it quality improvement project, be it teaching. You need to have, I think, at least 3 months of teaching, and then you need to teach healthcare professionals. It does not need to be doctors, it can be other professionals as well, like physician associates, HCAs, or any nurses, regular teaching to
Mm.
show commitment. Then other things like after quality case reports or publications, then conference attending and presentations. These are things that
Mm.
ultimately what they want somebody who is committed to the specialty. So that's what I did, and I made sure that I tick box all those things like quality improvement project,
Mm.
like publication, like teachings, like conference attending, like MRCP. I know MRCP does not contribute to the point system as of now,
No.
but the only reason why I did it for myself was it shows for me that I'm committed to the specialty. And I felt good. I improved my knowledge as well. So I felt it was good.
Okay, I think it's important to sort of note that with IMT recruitment, because some other specialties are recruiting different ways, and IMT recruitment portfolio is a very important factor because there's no MSRA exam at present. So what you need to do, the first step is to actually show them your portfolio achievement, rank them against the scoring system, and then say how much you score. And then based on those scores, you will get the shortlisting. So if a lot of people are scoring
Absolutely.
higher, the shortlisting criteria score will go up. I think it's important what you just said. Very important. I mean, if I want to apply for IMT, I think it's at least I need to at least give myself 12 months to actually start to prep for my portfolio because I can't suddenly think that
Yeah.
I'm going to apply on September and the application opening in the next month. Um, so I think in terms of the portfolio, what sort of things did you have and how much did you score on it? Because I think the scoring is totally out of 40 or something.
So last year it was out of 40,
Yeah.
and they changed it for 2025 recruitment to out of 30.
Okay.
So out of 30 means I scored 19 out of 30.
Okay.
And 19 out of 30, I felt I was still feeling like it was an iffy situation. I might not get an interview, I might get an interview. But I'll tell you where I scored so that the people who are watching will have an honest opinion as to how much I scored
Yeah.
and how I scored it. I scored for quality improvement project, leading a quality improvement project, which is 2 cycles of a quality improvement project. And I also used the same quality improvement. I mean, I also did a case report, and I used that case report. I published the case report in a journal, and ultimately I used the same publication to present it as an oral presentation at an international conference. So at an international conference, when I presented it, I was able to show that I was presenting the case report and I used it for publication as well. So that was one thing. Then I did teachings. I taught regularly over a span of 3 to 4 months over different topics related to medicine specialty topics that I felt it was good. So that was also very useful. And teaching courses, I did teach the teacher course, which was important. And I
Yeah.
felt that it also, apart from just ticking the box, it's a good learning opportunity for somebody
Yeah.
because I'm interested in teaching as well. It's a good learning opportunity for later on because it shows that you're also wanting to teach. I really enjoy teaching. So it was not something that I just wanted to do for tick boxing. So these are some of the things that I felt were important. Case reports, which is a publication, then quality improvement project, then presentations, then teaching courses. And yeah, I think pretty much that's what I did to score 19 points.
Uh, and in terms of when you said your case report, I mean, how much marks did you get for that? Because I think you can score higher on that domain as well if you are doing something.
Absolutely. So
Yeah.
I did not score it for an original publication because case reports are not considered
Yeah.
original, like meta-analysis or randomized control trials. They are not that. They are just simple case
mm,
reports or letter to the editor kind of situation where I scored 3 points for it.
mm, mm.
And please, for anybody who's watching it, I would definitely tell them, please mark yourself honestly,
Okay.
because it's very, very important to be accurate, and do not underscore, but please do not overscore as well. I marked myself only in those domains where I actually was scoring.
Mm, yeah. I think it's very important that to be honest on your application and like that. Uh, I mean, with oral presentation, you said you did an international conference. Was there international outside UK? Because sometimes they say that international conferences happening within UK can also count as well.
Absolutely. So as long as you have proof for that conference being an
Yeah.
international, so you don't get extra points for a national versus international conference. I was just wanting to attend a conference at an international stage because of its location as well.
Yeah.
It was in Bangkok. I wanted to attend
Okay.
it. It was a good learning
Mm,
opportunity about cardiology. I attended that conference. I got selected for that present for my case report. I presented it,
mm,
and it was an international conference outside of UK in Bangkok. So
okay.
I enjoyed the conference. I enjoyed presenting my case, and I got a
Mm,
certificate
mm.
showing that I attended the conference. So yeah, that was a good experience.
And I would just like to say again to the doctors watching this, the IMT recruitment website, if you go on internet, you can easily find that. That will have a scoring criteria very clearly written that how they score the applicants for the first stage of portfolio achievements. So this is not a secret. You can easily find what sort of achievement will give you higher marks, and then you can accordingly do those things slowly and gradually to improve your portfolio. I mean, after obviously after they've given you marks and they've told you that you've been shortlisted for the interview, you scored high enough to be shortlisted for interview. What was the experience of interview then?
So it's very variable from person to person, but the generalized perspective that I felt on my interview was it was a good experience. I enjoyed my interview experience. It was not very intimidating. It was not very over. I felt it was a good experience, and you just need to know what you are saying. Feel confident about it. Do not feel like you don't know what you're talking.
Mm,
If you're, because they very clearly mention in the interview scoring as well that you have a 2 minute presentation about yourself. So in that 2 minutes, it's like you're selling yourself very, very well.
mm,
So you need to be very, very confident and know everything that you're saying about those 2 minutes, be it your quality improvement project or your case presentation or your case report that you've done. How did you do it? Who
mm.
do you do it with? What was your learning from it? Because I think a very, very important thing that we ignore is how did we learn from it? That's something which is very,
Yeah.
very important. Be it a case report, be it a quality improvement project, be it anything that you did. What
Mm,
is your reflection from it? So that's something that I really feel is important for us as doctors, that we try to
mm,
reflect from it. So that's something that I feel in an interview, that was my part that I felt was good.
mm.
I scored full marks in my application and suitability section that they mentioned. So that I felt was because of the fact that I was fully committed to the field.
Mm.
And yeah.
I think yeah. So for the interview, I think there are some domains. I mean, we don't have to talk about specific what they ask you in the interview, but the domains they normally talk about is that you are, as you said, you need to show your interest in medicine, that you have done something to explore that interest as well. And then it's about, I mean, they might give you ethical case and then a clinical case as well, and then look at your management of how you're managing that. Is that right?
Yes.
So there are three stations, or I think there are different stations you go through. So,
Absolutely. Yes, you're absolutely right that there is a personal station. I won't call it, it's just a personal station about yourself.
mm,
Then there is a clinical domain which deals with clinical scenario, everything about the clinical scenario. How it's most important about the clinical scenario is how you approach it.
mm,
It's very important that for somebody who's working in medicine, he will know the day to days of how you approach it.
mm,
We have peri arrest calls, we have arrest calls, and you are a resus lead two, you are a lead two there because you are approaching this patient on a daily basis, be it a seizure patient, a new seizure patient, or an unconscious patient, a hypoglycemic patient, a patient who's in resus. You clock patients on a daily basis. You see
mm,
unwell patients, sepsis patients, stroke patients, ACS patients. You see them on a daily basis. So it's how you approach it. That's what they see on it, on your and most importantly, we forget, if you're in doing an investigation on something, on a patient, why are you doing it?
Mm,
You just won't say FPC, USNEs, LFTs, CRPs, and these investigations. You have to justify why you're doing these investigations,
mm,
because each and every investigation has a reason as to why you're doing it. If it's an AKI patient or a CKD patient who's on dialysis, you will
yeah,
do a USNEs patient. You'll do USNEs on those patients. If it's a sepsis suspected patient, you will do a VBG on that patient and a full sepsis screen.
mm,
So that's, you need to justify. And then I feel that's what the examiners are looking from you.
yeah.
That's what I feel. Obviously, it's very, I don't know what they're looking for, but that's what I feel they're looking for. Because if you say these things, they will know that you know what you're talking about. This is very, very important.
So first one you said was about yourself. So I mean that is sort of how many, what are the time on it? Is it 7 minutes, 8 minutes, something like that for
I think,
the,
yeah, I think it's again, first of all, it's 2 minutes about your own self,
yeah.
your own presentation, and then the follow-up questions happen.
So
So the
that
follow-up questions will be about, like, about what you've talked in those 2 minutes.
So it's
So
like sort of like selling yourself, as you said, like take us to your CV question that you know
absolutely.
you to take us in, and then you talk about your most important achievement. I think it's very important, as you said. I think you used the term QIP a few times. I mean, people uh, might who not aware of that, but QIP is sort of kind of audit part of audits. You know, when you do two audits, when you have assessed a service, for example, found any issues in the service, and then you implement some changes, and then do another audit, then it will make a QIP. So it's a term we use very commonly in
Yes,
UK, but somebody
absolutely.
listening from outside might get confused about what it means. So a series of audits when we will make QIP. But I think, as you said in the portfolio station, or the first one, about yourself, it's important actually to tell them that what you have learned, as you already mentioned. So it's not just enough to say that I have done a very amazing QIP, but they might need to know that what have you learned from that? What was your personal reflection on that as well? Same with the case presentation. If you do teaching, what are you learning from that experience? Because important, because that we do all of these things to improve our skills. It's not just about giving others something. It's about improving ourselves as well. So clinical scenarios, and you said it's about normally, managing acutely unwell patient, or common clinical problems which happens in medicine. And then again, your approach, they will look for that how systematic you are, how if you're doing any investigation, why you're doing it, and when you need to escalate it, and how you're doing that. Then the third one was it about the ethical scenario as well?
Yes. So the ethical scenario is also about common dilemmas that we face at
Yeah.
clinical practice, be it approaching a patient with an ethical issue at hand, a social issue at hand. How will you approach it? You need to have a human side to it as well. You need to understand the situation dynamically. It's just not how you feel, it's about how the patient feels. It's about a holistic approach. That's the key word that I will put it as.
Mm,
It's a holistic approach. It's a multidisciplinary
yeah.
approach. It's just not what doctors think.
Mm. Yeah,
It's about how, yeah,
I think our people for IMGs who have never not worked in UK, they get confused about ethical scenarios. I think I on my video series in the NHS job interview, I've done a few for ethical scenarios as well. Um,
yeah,
it's about most important thing is there to patient safety. I mean, there's some of the things we need to consider. The other thing is the patient's right to have their choices as well. So when as a doctor, when we think that we are the only ones who thinks what is the right for patient, but patient might be choosing something different. So it's about capacity, consent, and all those sort of things that can come in the ethical scenario as well. But it's also can come as a conflict resolution as well, from your
absolutely.
colleagues and your
As I said,
workers.
it's about the daily scenarios that
Yeah.
we face in clinical practice in
Mm,
working in the UK, which are common to us, and it's not something that we don't face. It's
mm,
the IMT interview, as I said, it's just about what you see on a daily basis in your clinical and ethical scenario. It's not something that you've never seen. It's
mm,
about your daily management to any patient, be
mm.
it a clinical scenario or be it an ethical scenario.
Um, uh, what is your advice for the future doctors, future trainees who are looking to get into IMT? What can they do now if they, for example, they might be in their home countries right now
Yes.
listening to this? What can they do in the home countries, or if they are already in UK, what can they do here to improve their chances?
I think the most important is I understand that the most important is understanding the scoring points for IMT, because you need to get an interview first to apply. I mean, first get an interview and then give the interview. So first of all, for the interview, get your point system
Mm,
clear in as to what is the scoring pattern, and then work on that scoring pattern. Be you are in your home country, be it here, you have to get the points for the scoring pattern according to the scoring pattern and tick box those
yeah.
points to the best of your capacity, the maximum that you can get. So at least I would say that work on quality improvement projects, be it in your home country or here. Lead a quality improvement project by working with colleagues. And
Mm,
a quality improvement project does not need to be a very hi-fi setup. It can be a simple thing, but that makes a difference.
yeah.
That's something that you can do. A case report is something that you can do. It will not take a lot of time. It will take 2 to 3 months. If you are working, it will be a good case. You discuss with your consultant about a good case that they've seen, and you want to work with them to publish it with
Mm,
them. So that's something that you can do easily. It will get you 3 points.
mm,
A quality improvement project, I think, will get you 4 points. And then you can use it to present it at some conference nationally or internationally. That will get you 6 points. So, and teaching as well. Use your colleagues. Just, I think, regular teaching, either organize, arrange teachings and
mm,
then be a part of those teachings, present
mm,
them. I enjoyed teaching, so it was natural for me. But then if people just want to get points, then arrange a regular teaching session
mm,
for at least 3 months and get it signed with a consultant who supervised you for that session. That will get you, I think, 3 or 4 points. I'm not exactly remembering because it's been like 3, 4 months.
yeah.
But then that's the scoring system. It's very achievable.
Mm,
It's not a very hi-fi system. It's very easily achievable in the next. But then you need to start afresh and plan. That's
mm,
what I would say.
mm. About the experience to teach, I think I agree with this. And I mean, what you just said, that when we as a doctor think about teaching, we automatically think about medical students and teaching medical students who come to our wards or something like that. But I think teaching can be more widely than that. That I myself have taught the MDT staff, which includes, physiotherapists, occupational therapists, nursing staff, even sometimes psychologists as well, because I'm work in the mental health. So, and as you said, it's important to understand what they're looking in that experience. It's not just that you have taught them once, or you were just doing some random sessions, writing that the medical students are coming to my ward and I'm doing a bit few sessions with them. That's not enough. I think they want, when as you score maximum or good marks on that, it's about setting up a teaching session or teaching series of lectures, basically, where you can evidence them as well, that you can get feedback from your learners, you can get feedback from your seniors, and then they can sign you off by saying, giving you evidence, like something in writing that you have taught nurses, for example, for over 3 months and given a series of lectures of 12 different lectures or 10 different lectures. So what was the evidence you gathered for that? Did you get something in writing from your consultant about that?
Yes, so I gathered formal feedback from
Yeah,
from the people that I presented
yeah,
with the date, with all the questions. It can be a Google form from that just for
yeah,
feedback, but then it needs to be reviewed by the consultant, and a letter saying that these are the dates that I presented them on, and these are the topics that I presented them on. This was the audience that it was presented to, and basically it needs to be a clear description
mm,
showing on a letter with a consultant or a supervisor who signed you off saying that these are the series of lectures on these many dates that you've
yeah.
done as teaching for these people.
I think that's great. I think quickly, if you can tell us about your QIP, that what was it? So I think that people might
Yeah.
get some idea
It
about what.
was it was basically it was about a very common thing that I feel I was personally seeing all over the world, not in the UK only, but then all over the world, because it was about burnout in doctors.
Mm,
I felt that it was a very common topic, and so I used a questionnaire to assess the burnout and the severity of burnout in because I was working in ED. I thought I'd start with ED first, and then it was about burnout in ED doctors, and then I implemented change like rearranging doctors' rooms, making it more structured, clean, tidy, getting food on a weekly basis with other colleagues, regular staff room reorientations, meetups outside work,
yeah,
and using Ramzan for iftar gatherings together, small changes, and then feedback forms through what other changes can we implement, and then basically re-auditing it on
Mm,
the second cycle, saying that this is the change that I brought about. What do
mm,
you think about the burnout after 3 months now? Do you feel any better?
mm,
Yes or no? And what all other things will you recommend?
mm.
And just to add on, I've just had this quality improvement project that I've done being selected as a poster presentation at the Bristol conference. So I'm happy about it. Yes.
That's great. I think it's a very good example. So when we are talking about quality improvement or audits, we always automatically again go to the patient care. Then it's to do with patients. I think you were actually was actually a very good example that it doesn't need to be patient. It can be also done on the staff and other regulations or things that
Absolutely.
happening on the board or hospital environment. I think that's thank you very much for sharing the experience. I think it's great to actually talk about this. I mean, because practically people, as you said, all the information is already available online. But when
Absolutely.
people see real human beings who have actually gone through that process, that is a different level of motivation that an individual watching you will get, and then they can think, and if you can do it, then maybe they can also do it, and they can in the next round of training they can also apply for IMT.
Absolutely. I'm grateful for the opportunity and I'm happy to share whatever insights I have.
Thank you very much.